Hi, Moise here from Wound Academy. I'm going to talk about Hydrofera Blue application. I'm not going to talk about what kind of wound we can use it for and what kind of dressing is that. That's going to be in a different video. Stay with me when I'm talking about two types of Hydrofera Blue dressings. First, Hydrofera Blue Ready Foam Dressing. This type comes in a ready to apply package, and you just open the package and select the right size. It comes in different sizes, and then you apply it to the wound bed. After that, you can secure it with the tape, or you can apply a secondary dressing and then tape it to the skin. It's very easy. And how long we can keep that dressing on, it depends how much drainage we have. If it's heavy exudate, we can change it on daily or every 2-3 days, but it can be in place for up to 7 days. This type of foam, Hydrofera foam, it can stay, it can go under the compression bandage like Coban or other type of compression dressings. Second type of the Hydrofera Blue is classic foam dressings that really they are the first type of Hydrofera that came to the market. So we have the first step in this type of dressing. It's like a dry foam, so we have to hydrate it. And one important step in this one is that you have to remove the excess of the fluid from the foam. And the reason I'm making this video really is this step, because I've seen the people that they apply the foam dressing, Hydrofera foam dressing, classic, in some patients, and very wet, and they cause maceration, skin breakdown, and causing many problems. So please make sure you remove the excess fluid and saline from this dressing. The second step in Hydrofera Blue classic application is just to apply it on the wound bed. You should cut the size of the wound, and if there are like rolled edges of the wound, we can let it to just overlap to the healthy skin, but should not be wet. Another important point is you cannot go with the deep wound for packing with this like foam. And if needed the packing, we're gonna go explain it in this video what type of packing we can use for the deep wounds. But if they're undermining, you can just slightly put it under the edge of the wound and then cover the undermining when we apply it. The third step is the covering this Hydrofera Blue Classic. Because this one is not going to be the secondary dressing. This is the primary dressing and needs a secondary dressing. Secondary dressing, it depends how much drainage we have. We can use very absorbent or just a mild gauze or something like that. Doesn't need to absorb a lot. So if it's really draining a lot and heavy exudating, large amount of exudate in the wound bed, so we can use Mesorb, extra Zorb, or abdominal pad or something lighter. Step 4 is dressing change in Hydrofera Blue Classic. So when we're going to change the dressing, usually when the dressing is saturated and we have to change it, and when it happens, the color from blue is changing to white. So if this dressing can stay up to 72 hours, so first dressing change is gonna be done in 24 hours from the application. And if the dressing is white, so we have to change it every 24 hours. If it's blue, then we leave it for the next dressing, we will leave it for 48 hours. And after 2 days, if it's still blue, we can leave it up to 72 hours. But we should not leave it more than 72 hours. Like other wound dressing, Hydrofera Blue may stick to the wound. So if sticking to the wound, we have to moisten it and then remove it like other dressing that we do. As I said before, we should not force the regular Hydrofera for packing. For packing, there are some packing strips that is tunneling dressing we can use for deeper wounds. Just one important point about this one is you cannot moisten the full dressing and put it in. You have to just moisten the tip, because if you moisten all of it, it's going to be difficult to pack with, and you're not going to be able to pack it. So there is just one size. It's for the bigger wound. Usually it doesn't work, but for the smaller wound it can be packed. However, if the wounds are very small, because they are the thickness of this dressing is about 0.9 centimeters, and it's really difficult to pack in the smaller wounds. Thank you for watching this video. If you have any question or comments, you can leave a comment on this video, or you can contact us on our website www.woundacademy.online.